We all have families, we have friends, we have colleagues and other members of the community that may not have Medi-Cal, but really depend on this healthcare system to provide critical healthcare services, really essential healthcare services. So when we talk about the emergency room serves everyone in the community and not just an individual that may qualify or have Medi-Cal. First and foremost, you need to understand that Valley Medical Center is a hospital that provides specialized care. So not only do we provide emergency room care, we provide trauma care, we provide burn care. And to put a finer point on that, Valley Medical Center was ranked number 7 in the nation for rehabilitation services. Those are services for individuals that have spinal cord injuries, brain injuries, stroke. These are services that everyone in the community needs. And so irrespective of your insurance coverage, the likelihood is that you may very well come to Valley Medical Center for those services. And irrespective of what insurance coverage you have, you want the best care for yourself and your family. And so we're very fortunate to have a hospital that serves everyone in the community. Let me answer that question in 2 ways. One is around access to care. So if you think about where St. Louis Regional Medical Center is located, it is located in the South County. It is along the 101 corridor, and everyone that drives through or lives in that community deserves access to quality healthcare services, particularly when we talk about emergency room care and critical care services. So it is really important to understand that the 4 hospitals in this community are geographically located to ensure that everyone has access to care, irrespective of your insurance coverage. So number 1 is access to care, quality health care, but it also helps us actually consolidate and create centers of excellence. So you don't need to have 3 different cardiac programs. You can have particular hospitals that provide for care and focus on other areas. So it is neither a mistake from a financial perspective or from a quality of care or access standpoint. Let me just say this, and I think everyone will have this appreciation. When you cut your budget by 25%, and that is what it represents to this healthcare system. We're talking about $1 billion in lost revenue due to HR 1. That's $1 billion of a $4 billion operating budget. And you're saying, well, that's a large system and that's a large amount of money. But you need to take a step back and think about the level of care that we're providing to the community through the 4 hospitals, 15 health centers, serving 1/4 of the population here in Santa Clara County alone. And we're providing a level of care that is really second to none in terms of quality, because that is a standard as a public health system that we intend to maintain. But when you take $1 billion out of that system, something has to give. So if we're left with only 3/4 of our budget, the reality is that we have to figure it out, but someone is going to be impacted. And it could be your family member, it could be you, or it could be someone else you know. We train 1 in 4 physicians in Santa Clara County. 1 in 4. Stanford residents rotate through Valley Medical Center to get their experience, to learn how to be a physician. We train nurses. We have one of the largest nursing programs here in Santa Clara County. We have programs that support individuals in our community that are trying to get a degree in physical therapy, occupational therapy, respiratory therapy, become a pharmacist. These are all individuals that not only stay here at Valley Medical Center, but go to other hospitals in our own community, but go to other hospitals and healthcare organizations throughout the United States and worldwide. The reality is that we have a significant impact on the future generation of individuals and professionals in healthcare. And that is a lasting impact. There is a lot that even members that have lived in this community for a long time do not appreciate about what they have in this public healthcare system in Santa Clara County. And I've said this before, typically people learn about us when they have to access care in our system. And time again, people will say to me and to others that work here, the doctors and nurses, I had no idea. So just think about this. We are here when you need us in your probably most critical moments. And that's the reality of healthcare. The other part of it is that if you think about it, a lot of people that work here do it because they know they can make a difference. And not only in terms of the patients they serve, but really an impact on the entire community. And so I think people just need to realize that this is a gem that we need to protect.